Hello viewers, thanks for tuning in again. Our guest today is a doctor at All India Institute of Medical Sciences, which we all know is Aiims. Her name is Dr. Priyanka Sehrawat. She's a neurologist as well as a general physician. So today's session is going to be informative for all of us. So stay tuned for this session.
Hi, I'm Dr. Priyanka Sehrawat. I'm a neurologist based out of Gurgaon. And I'm here with Mayank at his NH Talkshow podcast. And when I got to know about it, I had so many questions in my mind. But if you ask me now, I'm really excited and very much thrilled to be here. And if you are listening to this, please join the podcast. He is doing his best to make you aware about fitness, diet, and lifestyle, which is the most important thing right now if you want to stay away from any kind of disease.
Hello, Dr. Sehrawat. A very warm welcome to our show.
Thank you and good afternoon.
A lot of doctors, you're a doctor, you're a neurologist at Aiims, and a lot of doctor, I know they aspire to be in one of those, doctors at Aiims. How do you feel and how difficult was it for you to crack it?
Yeah, so Aiims is Aiims. Everybody's dream, every MBBS student's dream is to get into Aiims. Yes, so I was doing my MBBS and I had to take 1 year, break to crack MBBS entrance exam. I could not get into Aiims entrance, of course. I did my MBBS from Lady Harding. I got into it via Delhi PMT. So when I was doing my MBBS, I always thought, what are they teaching at Aiims? What could be different? And I visited Aiims once for their festival, and I realized that there is so much going on at that college, and I just wanted to get into it. So in my third year MBBS only, I started preparing for Aiims entrance, and I think by the end of internship, I was fully prepared because the day I took that exam, I was entirely exhausted. I was completely empty-minded, and I was like, I can't do it again. If I'm not able to crack it this time, I can't give it more. So, but then I cracked it. I got a good rank. I got into MD medicine. And when I got into Aiims, I realized it was really good. I mean, Aiims is completely different than other colleges.
So how it is different?
Yeah, so in Aiims, first of all, everything was digital. The discharges were digital. You got investigations within 1 hour, within 2 hours. You had everything, every single investigation you name to diagnose a patient, it was available. It's very difficult to find that thing in different colleges in India. So I think Aiims was one place where if I wanted to know the cause of diarrhea in a patient, I could, even if I had to go into detail. So that's why Aiims get the rarest of rare cases, because they're able to diagnose. They have all the facilities. Secondly, the atmosphere is so good, and academics, it's superb. It's excellent. I think whatever I've learned was those 7 years in Aiims that I've done there. And it was really good. They really focus on academics. Why is the patient having this? They're not like that. It is a patient of gastroenteritis. Okay. So patient came with abdominal pain. What I had learned during my MBBS was that, okay, you get an ultrasound done, you give antacids, you give some injectables, and patient will be okay. But at Aiims, that was not the case. At Aiims, the question would be why? What happened? And of course, in 90% of cases, you do not find the exact cause, but still the why remains. So you have to go into that 10% of the causes. You have to investigate. You find out the cause, and then you treat the patient. You get to learn a lot. While doing that process, you get to learn a lot.
So you're saying that Aiims is more tech savvy?
Yes,
in terms
and
of
academics prone.
And academics prone. Okay.
Yeah.
So tell us, how long was your duration, or for how long you have to study to be in Aiims?
Yeah, so for Aiims entrance exam preparation, I started in around 2012 when I was in my third year MBBS. I cracked Aiims exam during my internship. The exam was, I think, on 9th of November 2014. And I started my MD medicine in January 2015.
So the entrance exam is NEET in this, right?
No, now it is named as NEET. At that point of time, it was only Aiims entrance exam. And then there was All India entrance exam. There was no, this term was not there at that time, NEET. So I got into Aiims and I started in January 2015. I was there till 2022 June, July, till my DM Neurology got completed. And so about 7 years. 7 years because 1 year I had to take maternity leave during my first year DM Neurology. But those 7 years were really fruitful, and I'm happy. And I think once you study at Aiims or you work at Aiims, you don't want to work anywhere else because you don't get that environment anywhere else. So I think I learned a lot from Aiims and whatever I am doing now. So why I wanted to tell about diet, lifestyle, prevention so much, because this is the thing that is given utmost importance there also. During our rounds, we were not only asked about the diagnosis, we were also asked about what has the patient eaten and how. Has he taken his food on his own, or did somebody else help him, or did he take it through a rice tube? How much? How many calories? What was the urine output?
Right.
Those were the basic things that were asked, and those things are usually missed at other places, if you see. So I think that's why I think that's why everybody is trying to get into Aiims, and it's really good. If you get into Aiims, it is a good experience. It has been a great experience for me, and I think for all NEET aspirants, if you are hearing me out, then go try for Aiims entrance exam also, because you have to see that that environment, that academic seminar prone environment, and trying to find out the root cause. Always find the diagnosis. Never just go to the management. Do not go to the treatment first. You find the diagnosis. You find the root cause and then you treat it. Then only the treatment is successful. This is what I learned at Aiims from my professors.
Okay. So Dr. Sehrawat, you're a neurologist. Yeah. In simple terms, tell us what are the different functions of a brain like any other organ?
Right. So, see, our brain is a very complex organ and it is divided into different lobes, different parts. You must have heard about the frontal lobe, the parietal lobe, and every lobe, every part has a different function. So, for example, our frontal lobe is giving us the answer to, why. Why? So, judgment, insight, and behavior, aggression, or, personality. It is all controlled by our frontal lobe. Then comes the temporal lobe. Now, temporal lobe is more about memory. So, memory, retention, and memorizing things, recognizing faces. Then comes the parietal lobe. Parietal lobe gives answer to the most of where. So, like a geographical orientation, a visual spatial orientation. Right now, my brain, my body knows that I'm sitting at this place, and my orientation is that I'm sitting to your right. Right, so I know that because of my parietal lobe. So, for example, some people, when dementia patients, they forget where the kitchen is or where is the way to the washroom. So, their parietal lobe is affected in that. So, the GPS is set in the parietal lobe. Then comes the occipital lobe. It is more about vision. The visual pathways are connected to that lobe. So, see, every part of the brain has a different function, and whatever part gets affected, those functions in particular get affected.
So, I mean, we usually hear a lot of times that brain is the only organ in the body that controls everything in a human. Is that correct?
Yes and no. I'll explain why. Our brain controls most of the functions in a way that it gives out the fibers to all the organs. So even the visceral organs, the internal organs are getting some fibers, some signals through the brain. The brain gives signals to our heart to beat. The brain is giving signals to our fingers to move, the fine motor, the gross motor. The brain is giving out the fibers that make us sense the cold, the hot, right? The hot things. All these fibers are given out by the brain. So yes, in a way, brain is controlling all the organs, but then the organs also have a very major important part because they are also made of certain muscles and fibers. And
Correct.
if those fibers are working well, then only those signals are also going to work.
Sure.
So it's kind of like a wiring circuit, that the wire is there, but then the circuit also needs to be correct.
Sure. So we'll understand, there are different, let's say, recently I've come across a patient in my family who had a brain stroke. So tell us what could be the possible reasons of having a brain stroke and how it really affects you and your
So
life?
brain stroke is the most common neurological issue after headaches, of course, and it is a very deadly issue also, and we should know about it. Why? Because I'll tell you what happens in stroke. Stroke, in a layman term, if I want to tell you what is stroke, then if the blood supply to some part of your brain is cut off, now that is stroke, right? If certain part of your brain is not getting blood not getting nutrients, not getting oxygen, that is stroke. And
Right.
it can happen with two reasons. One is if you have a clotting, if you have a clot in your blood vessels in the brain, and that clot obstructs the blood flow, and now the area doesn't have any blood supply and the area goes dead. So that is an ischemic stroke. The second one is mostly because of high blood pressure, and that is when the blood vessels rupture due to the high blood pressure, right? So they rupture and lead to hemorrhage. So what we usually call as brain hemorrhage.
Yeah.
Yes, so that is another type of stroke. Now, why is it important to know about it? It is important because it is a very time sensitive thing. In our brain, we have almost 200 billion neurons. And with stroke, every hour, whenever there is no blood supply, if a large part is not involved, almost 120 million neurons get affected in an hour. They die. Every 11 seconds, few neuronal cells die. So every second matters. So we also, in neurology, we also call it as time is brain. You know, that is how important stroke is.
So, apart from stroke, what other things are related to brain? I mean,
The other neurological diseases.
diseases, yeah.
Right. So if we, the most common neurological issue right now is headache. Secondly, issues with our vision, seizures, epilepsy, right? Then issues with our muscles, not being able to move, or issues with walking or maintaining balance, not able to maintain balance, not able to walk without support, not able to get up without support, not having any feeling in the palms, or having tingling sensation in the palms or in the soles, in the legs, or having pain in the back that is radiating to your leg. All of this somehow is connected to the nervous system, either the central nervous system, which is the brain, or the peripheral nervous system, which is the nerve fibers. So I think these are the most common neurological issues. This is a very vast topic, but these are the most common ones that we have.
Can we talk about the brain stroke a little more?
Yes, of course.
So, as I was telling you, that somebody in our family had a brain stroke. So we were told by the doctors that if you get him treated, which was a surgery in 4.5 hours,
Right.
then there are chances for him to be normal or survival, to be precise. So we did that. How true is that? Is that really true?
Right. So yes, that is true, and that is called the window period. Right. So there is something known as a golden hour, and there is something known as a window period.
Okay.
The golden hour is the first hour when the blood supply is gone, but the cells are still, dying but not dead. And after the golden hour, 4.5 hours is the window period till when we can actually, give some injectables to dissolve that clot in the artery if there is a clot. If there is a hemorrhage, in hemorrhagic stroke, this 4.5 hour window doesn't work. It's only for ischemic stroke. When there is a clot in the vessel, only for that, yes. But if there is a clot in the larger vessel of your brain and you take it out timely, then it helps a lot because it restores the blood supply very fast. Till the blood. So in 24 hours, almost all of the area becomes dead. Whatever area that blood vessel was supplying, it's gone. So that's why this window period is given.
So for him also, as I mentioned, we got him treated, or the surgery was done within that window period.
Okay.
But I think the memory is not 100% back. Or I won't say that memory is not 100% back, but he's unable to speak. So whenever he's saying something, he says something which you don't understand. Yeah.
Right.
But as per him, he has said whatever he had to.
Right. So see, the reason for that is how much area got affected, what part got affected. So our speech center is mostly in the left side of the brain.
Right.
And it is very near to the opening of a major blood vessel. And that is the area, if that blood vessel has a clot, that area gets affected more and first.
Sure.
So probably what happened with your patient is that his speech center was already gone more than 50% gone when this intervention was done. But if this intervention was not done, more of that area, the temporal lobe, the frontal lobe, could have gone by, because the speech center is placed in between the frontal and the temporal lobe, the inferior temporal, the lower part of the frontal, and the temporal lobe. So around that area would also have gone by. If the memory and speech are still not there, the only recovery in stroke is with exercise, with physiotherapy and exercise. Now, when we as neurologists suggest physiotherapy, we don't say you get a lifetime physiotherapist who is coming at home or anything, but you learn the exercises. You get a physiotherapist for about 15-20 days, you learn the exercises, and then a family member can also do it. The only point is, whatever function is affected, you keep repeating that. If, for example, if the movement of this limb is affected, if I had a stroke and this hand is not working anymore, then the physiotherapist will tell me how to make this work, right? But then you have to know that the joint mobility should be maintained, because now the fibers, the signals for the motion are not there. So you have to train your hand, you have to have that signal by yourself that yes, we need to move the elbow, we need to move the wrist in a way that it was moving earlier, we need to move the shoulder.
Right.
This is what is exercise all about. This is what rehabilitation of stroke is all about. This is the most important part.
Sure. So let's come down to the other diseases that you were discussing, and I think the most common one is headache and migraine. So tell us, what is the difference between a migraine and a headache?
See, headache तो एक काफी broad spectrum term है. Headache is a big term. Headache में types of headache होते हैं. A migraine is the most common type of headache. Migraine without aura. Aura होता है जिसमें patient को पता चलता है कि हाँ, मुझे migraine का attack आने वाला है. For example, कोई flashes of light दिखेंगे या फिर vomiting का feeling आएगा और उनको headache start हो जाएगा. Without aura migraine is the most common type of headache, जिसमें पेशेंट को पता नहीं चलता, सीधा सर में दर्द शुरू होता है और वो बढ़ता चला जाता है. It is very severe, it is very throbbing kind of a headache.
Right.
The person wants to just lie down in a dark room and cannot even stand a television or a mobile phone or a ringtone. That is how a typical attack of migraine goes. Why knowing about migraine is important? Because first of all, it is the most important type of headache, and secondly, इसके कुछ triggers होते हैं. जैसा कि मैं हमेशा अपनी वीडियोस में भी बताती हूँ, there are certain triggers which triggers it. अब migraine ऐसा नहीं होता है कि हमें सिर्फ स्ट्रेस से होता है, but our lifestyle, our diet, it triggers migraine a lot. अगर आपने खाना टाइम पे नहीं खाया है, अगर आपने रेगुलर टाइम पे ब्रेकफास्ट नहीं किया, सो आई ऑलवेज टेल माई पेशेंट्स टू हैव ब्रेकफास्ट एट 9, लंच एट 2 एंड देन डिनर एट 8 PM. अगर आपने रेगुलर टाइम पे खाना नहीं खाया, अगर आपने 30 मिनट्स का वॉक बिल्कुल नहीं किया, अगर आपका सेडेंटरी लाइफस्टाइल है, आपको नींद ठीक से नहीं आई, आप सो नहीं पाए, आपने ओवर थिंकिंग किया, स्ट्रेस लिया, जोर से बात कर ली, धूप में चले गए, ट्रैवल किया लंबा, तो ये सारी चीजें, अगर आप माइग्रेन प्रोन पेशेंट हैं तो आपको हेडेक जरूर ट्रिगर करेंगी. तो इन चीजों को समझना बहुत जरूरी है, क्योंकि माइग्रेन पेशेंट्स में सिर्फ मेडिसिन्स डोंट वर्क. They have to change their lifestyle, they have to get their diet and lifestyle back on track. Then only they can be free of those headaches. If they don't avoid their triggers, अगर वो triggers persist करेंगे, तो even with medications, they are not going to have 100% relief.
Right. So again, because I have a very good social network, so I know a lot of people, and I know in my group a lot of people get headaches every now and then.
Yeah.
And it's primarily because they may not have eaten at the right time.
Right.
So uske alawa bhi there are reasons you get headache, or that's the main primary reason?
Being empty stomach is one of the main causes of migraine, that triggers migraine. Plus, why having breakfast is important. I'm not against intermittent fasting. Intermittent fasting is a good thing, helps a lot of people to lose weight, to maintain their lifestyle, to maintain their muscle mass. But migraine patients, typically, I do not advise them to go ahead with intermittent fasting also. Why? Because एक तो चीज होता है कि migraine is kind of a vascular headache. There are certain small neuropeptides, छोटे छोटे molecules होते हैं ब्रेन में, जो कि किसी पर्टिकुलर ट्रिगर से बन जाते हैं इन पर्टिकुलर एरिया, और वो इसी एरिया में हेडेक करते हैं, और वो काफी सेंसिटिविटी भी कर देते हैं. तो माइग्रेन पेशेंट्स ना यूजुअली ये हिस्ट्री भी देते हैं कि हमने स्कैल्प को छूते हैं तो भी हमें दर्द होता है. So that is a typical history of migraine that happens because of these peptides. अब ये छोटे छोटे मॉलिक्यूल्स कैसे बनते हैं? तो जब हम एम्प्टी स्टमक होते हैं, that triggers certain hormones and those hormones trigger certain production of these certain peptides. And these peptides then trigger the pain in that particular area जिसमें आपको susceptibility है पेन होने की. तो वो एक बहुत बड़ा रीजन है. सेकेंड रीजन वाई आई ऑलवेज एडवाइज people to have breakfast before going out is because breakfast is what gives us immunity for the whole day. Breakfast हमें पूरे दिन के लिए strength देता है, पूरे दिन के लिए immunity भी देता है. You know, everybody doesn't have a car or their private vehicle. People also use public vehicles. They also use metros, trains, Ola, Uber with, other people. So you don't know, tuberculosis is also one of the main diseases in India. It's an endemic. Every 3 out of 5 people have already been exposed to tuberculosis bacteria. And the main reason is empty stomach. जब आपकी immunity नहीं होती है, तभी वो bacteria आपको attack करता है. Yes. So see, if you talk about me, I have been exposed to tuberculosis bacteria, but I know once my immunity goes down, it's gonna come back. वो dormant stay करता है. तो इम्यूनिटी, अगर हमें पता है कि हमारा ब्रेकफास्ट ही हमें इम्यूनिटी दे रहा है, अगर हम खाली पेट घर से ना निकले तो हम 2 चीजों से बच सकते हैं, एक तो हेडेक और दूसरा ट्यूबरकुलोसिस. तो फॉर इंडियंस स्पेसिफिकली आई विल नेवर सजेस्ट कि आप ब्रेकफास्ट को स्किप करें. व्हेन आई यूज्ड टू गो टू एम्स, आई यूज्ड टू लीव गुड़गांव एट अराउंड 6:30 to 7 a.m. because our rounds usually started at 8:30 and उससे पहले हमें ब्लड सैम्पलिंग, पेशेंट को देखना, रेडी करना, फाइल स्टडी, एवरीथिंग हैड टू बी डन. But 6:30 निकलने पे भी I used to have some breakfast in the morning before stepping out. So even if it was egg bhuji, even if it was 2 boiled eggs, even if it was 1 bread omelette, even if it was 1 chapati, 1 vegetable or something, but I used to have something and then go out. I never went out empty stomach. And that has helped me a lot even during COVID.
डॉक्टर सहरावत, आप ये बताओ कि हेडेक होता क्या है, मतलब क्या होता है कि ब्लड सर्कुलेशन बंद हो जाती है ब्रेन में, मतलब क्या होता है, हेडेक क्या है?
हाँ, तो हेडेक अब लेमन टर्म में जो सरदर्द हम बोलते हैं उसमें यूजुअली हेडेक होता है हमारे वेसल्स के फूलने की वजह से, जिसको हम कहते हैं वेजोडाइलेटेशन या वेजो कंस्ट्रिक्शन. अगर उसका रेगुलेशन प्रॉपर्ली नहीं हो रहा है और उसका रीजन होता है वही छोटे छोटे मॉलिक्यूल्स जो कि ब्रेन में डेवलप होना शुरू हो जाते हैं. तो हेडेक के बहुत सारे टाइप्स होते हैं, जैसे माइग्रेन की हमने बात की, उसके अलावा क्लस्टर हेडेक, उसके अलावा ग्लोकोमा यानी कि काला मोतिया. अगर आंखों का प्रेशर बढ़ता है तो वो टिपिकल माइग्रेन जैसा हेडेक के साथ प्रेजेंट करता है. इवन साइनसेस का इन्फेक्शन, साइनोसाइटिस, तो अगर आपके साइनसेस ब्लॉक्ड है, म्यूकस प्लग उनमें है और इन्फेक्शन है, तो दैट विल ऑल्सो प्रेजेंट लाइक अ वन साइडेड हेडेक, माइग्रेन जैसा हेडेक. तो जब भी सर में दर्द हो तो पहली चीज है कि अपना डाइट और लाइफस्टाइल को तो ठीक करना ही है. आइज का चेकअप बहुत जरूरी है. अब जब भी आंखों के चेकअप की बात आती है, हर सर दर्द का मरीज सिर्फ आंखों का नंबर चेक करवा के आते हैं, बट उससे ज्यादा इंपॉर्टेंट है आंखों का प्रेशर और आंखों का पर्दा. द फंडस and the intraocular pressure is of utmost importance. So if you have headaches, then you go to an eye specialist and you get your 3 things done: your pressure, your fundus, aankhon ka parda, and your vision, all 3 things. Secondly, always remember to look out for cold, recurrent cold. आपको बार बार जुकाम हो रहा है, आपको nasal blockage हो रहा है, उसके साथ में अगर आपको headache हो रहा है, you probably have sinusitis, then you get that treated. अदरवाइज वो नहीं हो पाएगा. तो हर हेडेक के टाइप के अलग अलग कॉजेज रहते हैं.
नहीं, बट हेडेक जब होता है तो अंदर ब्रेन में चलता क्या है? क्या मैं वही जैसे पूछ रहा हूँ कि बिकॉज अ लॉट ऑफ पीपल व्हाट दे डू, दे स्टार्ट हैविंग दोज ब्लड थिनर पिल्स कि ब्लड सर्कुलेशन जो है वो बढ़ जाए, जो डिस्प्रिन है या मतलब व्हाटएवर दोज पिल्स आर,
एस्पिरिन, राइट.
तो वो मैं ये जानना चाह रहा हूँ कि देखो कॉज तो चलो जो है वो है कि क्यों हो रहा है, बट ब्रेन में क्या होता है कि जिससे वो हेडेक हमें देता है?
हाँ, तो वो मेनली वेजोडाइलेशन होता है, हमारी ब्लड वेसल्स का फूलना. क्योंकि ब्रेन तो एक पेनलेस स्ट्रक्चर है, लेकिन ब्रेन की जो कवरिंग है दैट इज अ पेन सेंसिटिव स्ट्रक्चर. तो जब वो कवरिंग इरिटेट होती है बिकॉज ऑफ एनी इन्फेक्शन या बिकॉज ऑफ वेजोडाइलेशन, देन इट गिव्स अस पेन. एंड दिस पेन टिपिकली कम्स ऑन दीज ट्रिगर्स दैट वी हैव टॉक्ड अबाउट. और इसमें हमें ये पता करने की जरूरत है कि आपको इकोस्प्रिन इज नॉट गोइंग टू हेल्प यू इन हेडेक्स. You know why? Because ecosprin या aspirin या जो
Disprin.
हाँ ये जो टैबलेट्स हैं ये ब्लड थिनर्स होते हैं.
हाँ.
They are medications for stroke or for any clot in your heart or your brain.
Right.
They are not, the headache you are having is not because of a clot. Ischemic stroke जो होता है जो clot की वजह से होता है, that is typically painless. You must have noticed in your patient also. You must not have probably would not have complained of headache, right? Right. So clotting in the brain doesn't lead to headache.
Right.
First of all, we need to know that. And it is the vasodilation जो हमारे अब अगर हम breathing exercises करते हैं, how does meditation help in migraine? So breathing exercises lead to alteration in the oxygen and carbon dioxide levels, and they lead to changes in the blood vessel diameter. और उसकी वजह से it helps. So there is a scientific reason why it helps in migraine. So even me, I recommend meditation to each and every migraine patient, whoever can do it. Otherwise, any physical exercise. But taking aspirin is not a solution for headache.
But what else could one do if they're having headache? जिससे उनका headache चले जाए if they don't take the tablets and the pills.
So जिस time पे headache हो रहा है, they can go ahead with breathing exercises, take some water, a glass full of water. That helps in regulating the blood vessel vasculature and the diameter, and washing out the peptides also. And if you are sedentary, then don't just lie down. You keep on walking. Even if you have to walk in your room, you take a walk. It helps with headache.